Mild splenomegaly कैसे पता चला? Huh? On palpation, he'll be on examination, he'll be figured that out. Able to figure that out. Now, what is the significant finding here, which I have highlighted? Step ladder fever pattern means what? There is rise in the temperature. Temperature decreases also, but never touches the normal temperature. Okay. So, can you give out some diagnosis? What do you think this is? Are these symptoms present in your patient, the given case before? Yes or no? Some are present, some are not. So we will be discussing about enteric fever today, and these are the symptoms of typhoid fever or enteric fever or slow fever. It is also known as slow fever. A patient will come with the history of fever, abdominal discomfort and fatigue, and he may complain of loss of appetite. You might find these road spots, this maculopapular lesions on his trunk. Okay, will complain of headache and mostly constipation. When such picture is given to you in exam, and when there is this particular statement, step ladder fashion fever, along with all these symptoms, it will point out towards enteric fever. Okay. Now, enteric fever is caused by what organism? Salmonella typhi or Salmonella paratyphi A, B and C. Okay. There are some other non-typhoidal salmonella also, which can cause mostly gastrointestinal upset. Okay, gastrointestinal manifestations. But here it is systemic. Systemic means affecting the whole system, not just the gastrointestinal tract. Okay. So what is happening here? Salmonella typhi is entering your GI tract. How is it entering GI tract? Through contaminated food, water, right? Or uncooked meat, all those things, or dairy products, contaminated dairy products. Okay. Once it gets into your GI tract, through M cells that are present on the intestinal epithelial cells, through them they will cross and go to the submucosal layer, and from there the macrophages, they'll engulf them, but they are not sensitive to the lysosomes. So what will happen? They will survive there. Okay, and from there they'll go to mesenteric lymph nodes, and from there to the bloodstream and other organs like bone marrow, liver and gallbladder. Through reticuloendothelial system organs, they will spread. That is called as widespread dissemination. So this was what? This was intestinal epithelial cell. Through vacuoles, they will enter submucosal layer. Then through macrophages, they'll enter the bloodstream, and the secondary bacteremia will occur. What happens after that? You will get symptoms like these. Right? What is the important symptom here? Fever, remittent type fever with step ladder pattern. Okay, what is step ladder pattern? Yes. Then what are the specimens that you can collect? Since the organism is present in the blood system, what is it known as? I taught you in the last class. Bacteremia, right? So bacteremia, what is the sample you will collect here? In the first week? Blood. Then the antibodies will start to form. What is the sample will you collect for this in the second week to perform Widal test? You will take blood sample. Then for third and fourth week of illness, you can take urine and stool samples. Okay. Suppose this is the bacterium. What is this? What is this thing here? This is flagellum. So it has peritrichous flagella surrounding all the cell surface, right? So this bacilli, it has three important antigens. O antigen, which is the somatic antigen, then flagellar antigen and VI antigen. Out of these three, O and H antigen are used for antibody detection in the patient through Widal test. Okay? What will you do? Blood culture on BHI broth. What is BHI broth? Infusion broth. Okay, or else you can do automated blood culture. Automated blood culture systems you can use Baccolor or Bacti. Then stool culture. For stool culture, we have all these enrichment broths: selenite F broth, tetrathionate broth, gram-negative broth. And you might have known about this selective medium, McConkey medium, you have heard about it, right? Then there are highly selective media for stool culture, which is DCA, XLD, or Wilson-Blair's bismuth sulfite medium. And if you do urine culture, for urine culture, you can use McConkey again, right? This is how it would look. This is DCA, deoxycholate citrate agar. It shows pale colonies with black center. And xylose lysine deoxycholate agar shows red colonies with black center. Okay? Can you just remember the color and how it looks? Okay? Salmonella is a gram-negative bacilli. It is motile, catalase positive, oxidase negative. This is important. In TSI, it produces H2S with. In Typhi, it would have small specks. In Paratyphi A, H2S is absent, and Paratyphi B, it's abundant. Then, to confirm the serotype, we do slide agglutination test. Do you know about agglutination test? Okay. What is agglutination test? Not clot formation. Reacting visibly to form agglutination, right? Particles clump together which are visible. Then we can perform AST, antimicrobial susceptibility test. Performed for what? To see the susceptibility of the organism towards particular drug. Okay. Then there is Widal test. What will happen if you take a sample for Widal test in first 7 days or first week? So you have to take the Widal test sample, you have to collect the sample for Widal test after 7 days. Let the antibodies form first and then you can perform this test. What are you doing here? Antibodies are detected against the antigens I told you about initially, which are somatic antigen, O antigen and flagellar antigen. They are detected against which antigens? TO, TH, AH and BH. What is this? This is flagellar antigen for typhi. This is for paratyphi A and paratyphi B. Okay? Understood? What will happen? If you are finding some TO antibodies and TH antibodies, it indicates of S typhi infection. And similarly, if TO plus AH antibodies, it indicates of paratyphi A, and BH plus TO antibodies, it indicates of paratyphi B. Then how to read the result of Widal test? First thing, you have to take the patient's serum sample and dilute it. In these dilutions, we are adding antigen. And then you can find the results, you can interpret the results based on, in O antigen, you will see the granular chalky appearance, means carpet appearance, okay? And in H antigen, you will see, what you will see, this cottony woolly clumps. Cottony woolly clumps. So can you see here, this is showing titer positive to 1:160, and here this is the positive finding, okay? If it's negative, it will look like this, okay? So let's suppose, okay, this is observed under the glass. Reading this reading is taken in the mirror, kept under the tube. So here you can see this. This is looking like a carpet to you. This is TU antigen, and this cottony woolly clumps. This is TH. So what happens if the ratios are 1:80 for both? What you should do if it's borderline? If it's borderline, you should repeat the test after 5 days or 1 week, and if there is raised titer, increasing titer indicates that there is presence of infection in the body. Okay. This was about Salmonella typhi enteric fever. Okay. What is the treatment? You can give azithromycin 1 gram for 7 days. This is the latest guideline. Fluoroquinolones are showing high resistance. You can also give 3rd generation cephalosporins. Are there any vaccines available? Have you heard of any vaccination for Salmonella, for enteric fever? Have you heard of Typhorol? No, it's there. Read about it. Okay. Everything will be taught in the lecture series. This is SGD. You're supposed to be reading this first and discussing in the class. So this was about enteric fever. Then next case. Read next case. What are the symptoms? Black scab on leg. Okay. Any other finding? Occupation? Farmer. What do farmers do? Go to the bushes. There are where there is vegetation, right? So, what I have highlighted here? Black scab, a scar on the leg. Okay. This points towards what? Some vector might have caused it, some bug bitten this person, right? So what happened? He presented to you with fever, rash and black scab, okay. What happened? This person was bitten by this Trombiculid mite. Okay, this mite transports through its bite which bacterium? Orentia Tsutsugamushi. Okay, this is part of rickettsial diseases. There are two in Rickettsia family. There are two genera, Orentia and Rickettsia. So we are discussing about Orentia Tsutsugamushi. After this bite and infection through this bacterium, the person develops all these symptoms. What will happen? How do these bites maintain these bacterium? A female Trombiculid mite can transfer its bacterium through egg to the offspring. Okay. So then, how will you diagnose this? A person came to you with all these symptoms. You can perform all these tests. ELISA, PCR is always a common answer. Your immunofluorescence assay is the drug investigation of choice. Okay. How will you treat it? Which antibiotic? Doxycycline. Okay. How will you prevent it? Maintain cleanliness and hygiene, but mostly cover all your body surfaces when you are going to the bushy areas. Okay. This was about scrub typhus. Next.
Night sweats and joint pain. He consumes raw milk occasionally. Blood culture pregnancy.
Okay, what are the symptoms here?
Undeveloped fever for 3 weeks. Night sweats and joint pain.
What is additional information given?
Consumes raw milk occasionally.
Okay. What else? By profession, he is a vet, so he has to do a lot with the cattle, dog. Okay. What else? Blood culture is pending. So joint pain can joint pain be only caused by the infectious causes? No. So in such cases, you will figure out the other causes first. But here you have this additional information that he is a veterinary doctor. He handles cattle. He consumes raw milk occasionally. So it means there is a contact with a cattle. There is a chance that there is a contact with the infected cattle. Okay, this is a zoonotic disease which comes from animals. So what happened here? Infected animals excreting organisms in urine, milk, placenta and vaginal discharge. So he came in contact with all these and contaminated animal food products. He was consuming raw milk for days. So this caused him brucellosis. Brucellosis is what? Brucella, there are 4 species that are there in India. It's caused by the brucella, hence the name. What specimens will you collect? Blood, bone marrow, but is it possible to collect bone marrow always? No. So, blood sample. What is this? No. Why do you think it's Robertson cooked meat pot? Can you see the meat particles? No. Then you can see the agar, slant and liquid. So what is this? This is biphasic Biphasic pot. It's given here. Blood. It's about blood culture bottle. Biphasic medium. Okay. And this is bacterial or automated system ka bottle. Okay. This is how the Brucella species look. Gram-negative Coccobacilli. Okay. This is from the culture. We have made the smear and we have gram stained it. So it's looking like gram-negative Coccobacilli. But what is the test of investigation here? Gold standard serological test that we use. Standard agglutination test. What was it in scrub typhus? Immunofluorescence test. Okay. Then
Authentic fever for 5 days, severe cough, pain, jaundice, red eyes, weighted blood waters. Food, the blood waters in Mumbai, 10 days ago.
what are the symptoms?
Severe fever, 5 days, severe cough, pain, jaundice, red eyes.
Okay. Any other information? Weighted flood waters in Mumbai 10 days ago. Have you heard of leptospirosis before? No. Okay. There are 2-3 triads that you have to remember for leptospirosis. Leptospirosis is also known as Andaman fever. Okay, because of its epidemiological inclination towards that region. Other than that, there is something called as, okay, no, that was about Tsutsugamushi. There are 3 R's that you have to remember. One is rodent or rat, rice fields, and rainfall. So these 3 R's, wherever you see this in question, it will point towards leptospirosis. What do you mean by rice fields? They're mostly the wetlands, right? What happened in the question? Flood waters. So there are rats, they urinate, and Leptospira is transferred. If they are infected, they will infect the environment. So this is how it enters your system. What are the specimens you can take? Urine, blood, and CSF. But Leptospira as an organism is very thin, so you cannot see it under light microscope. You need dark ground microscope or phase contrast microscope. So you can use the silver impregnation method. What will it show you? It will reveal spirally coiled bacilli with characteristic hooked ends like umbrella handle. Have you seen the umbrella handle? It's like this. Okay, it will look like that. Can you see it here? This is how your umbrella handle looks. And it is spiral also, but it's coiled also. What is this? Have you heard about immunochromatography? You have heard? Where else can you use this? Was it used in COVID? It was used. You can use this for antigen antibody detection. IgM, you can see here, this is the positive test for IgM antibody. Okay, but here gold standard will be microscopic agglutination test. Okay, we are taking the antibodies from blood sample and we will react them with the antigen. It is observed under microscope. Microscopic agglutination test. Again, the drug of choice is doxycycline. Okay, this was about 4 miscellaneous, along with the enteric fever, this was about 3 miscellaneous bloodstream infections also. and infections also. So, any questions with this? What are the risk factors? Anything that comes to your mind, how it happens. You told me it's because of the contaminated food. Okay, it's because of if the person had previous Helicobacter pylori infection, he's prone to such infection. If there is achlorhydria, if the person is taking a lot of antacids, so many people they have the habit of taking antacids, pan 40, this and that. Such people are more prone to enteric fever. And what samples will you take at which week? First week you will take blood, second week serum, third, fourth urine and stool. What are the tests that you can perform? First is blood, you are taking blood, then blood culture, second Widal test, then urine and stool culture. What happens in the Widal test? What are the antigens that you are using there? Okay, what is O antigen? Somatic antigen. H is flagellar antigen. What if you find antibodies against TO and TH? If there is a positive test against TO and TH? Okay, and TO and BH? Okay. Is it a gram positive or gram negative? Gram negative. Okay. Any selective medium you can tell me about? For stool culture? Did I say about XLD? Did I say about DCA? What kind of colonies you will see there? Center with the black because of H2S. Then will Salmonella typhi have H2S and TSI slant? Small speck. In Paratyphi A, absent. In Paratyphi B, abundant. Okay. What is the treatment? Okay, azithromycin. Okay. Okay. Tongue was coated means it shows that the a person is not keeping well. It has abdominal discomfort. This can cause constipation also. This can cause diarrhea also. But most common picture is of constipation. Okay. And this, if it's not treated, it can lead to severe manifestations. It can cause ulcers in intestine. Okay, about scrub typhus. Scrub typhus is also common in, there is something called as Tsutsugamushi Triangle. So that triangle stretches from Pakistan to Australia to Asian parts, like above from Pakistan, below Australia, and all these, you could say, East Asian countries. Okay, that is known as Tsutsugamushi Triangle because this disease is common in those areas in Asia and Australia. Okay. So, what is the vector here? Some kind of mite. Mite. How does it transfer the organism? Through bite. Okay. That is vertical, that is different thing. That I'm telling you how they maintain, how one mite is having the organism, how the other mite will have it. So this is transferring infection through a bite. Okay. You go to the bushy area and the mite bites you, you'll get this disease. What is this picture? Biphasic blood culture bottle, biphasic medium. This is for automated culture system. This is gram stain smear, gram negative, cocobacilli. Okay. Then what was the last disease that you studied about? Leptospirosis is caused by Leptospira. Can you name the species? And Leptospira biflexa. Okay. What will be given in the question? That will give you the idea that this is leptospirosis. Wetlands या फिर rice fields या फिर rodents, along with rodents and rainfall. Okay. Can you observe it under the light microscope? No. What do you do? Okay. What is this investigation of choice? Microscopic agglutination test here again.